All right. Good afternoon, everyone. I'm now live on Instagram and YouTube, and I just want to say thank you to everybody who's going to join us tonight for this webinar. We put this together because the Cannabis Control Commission has recently voted on some new regulations that affect medical marijuana. And so MPAA wanted to start our live feed tonight and kind of introduce everybody to these changes so we can come together and understand what the commission is doing with medical cannabis. So I'm going to give everybody a few minutes to kind of get here, but we'll start by introducing myself. My name is Jeremiah McKinnon, and I am the president and executive director of Massachusetts Patient Advocacy Alliance. Our organization represents the coalition that worked in 2012 to get question 3 on the ballot, which was the ballot initiative that legalized medical marijuana in Massachusetts. And ever since then, for the past over 10 years, we've been fighting to implement the law and make sure that it works for patients and the communities where they live in. So we work with patients, we work with caregivers, physicians, lawmakers, local officials to implement the medical marijuana law and make sure that with all this focus on recreational marijuana, that medical marijuana does not get overlooked, because medical marijuana came first, and most people understand that patients have needs and that their medical cannabis is a right that they should be able to have access to. So that's what we fight for. That's our mission. And if you're a medical marijuana patient, just know that that's what we're out here doing. Our organization does advocate for you, and we work together with the Cannabis Control Commission. Massachusetts Patient Advocacy Alliance is a member of the Cannabis Advisory Board. So we do give policy suggestions to the commission on a regular basis, especially those that touch patients. So tonight, we want to discuss what's going on with the draft regulations and how those draft regulations will impact medical cannabis patients. And so the commission on July 19th of 2024 did approve a new set of draft regulations that they are now in the process of promulgating and releasing to the public. And there's a process involved, including public comment. And so we're kind of early in the stages of this regulatory adjustment. The draft language is out there, and the commission has updated the sections of medical marijuana and adult use cannabis. But for tonight's discussion, we're going to focus on the updates to the medical marijuana program. And the two major components here are telehealth and certified nurse practitioners. That's primarily what's being updated here. And I will say it's kind of a narrow update. So I want to know if there are things that you as a patient or as a viewer think that could be updated about our medical marijuana program. Please throw out your suggestions. If you have questions, please ask, because the commission has said that there will be a future regulatory adjustment, perhaps at the end of the year again. And if there is not such extensive updates now, we're hoping that maybe we can put forward some suggestions for this next regulatory adjustment and have some real big changes for patients. So if you have any suggestions on or how to improve the program, or any pain points that you've experienced that you want to see updated and changed, please feel free to share them with us tonight. So I want to just dive right into it. And the main topic, I think, that affects patients with this regulatory adjustment, which is telehealth. And I want to give everybody a little bit of background. Obviously, telehealth has become a major component of our healthcare system globally. And so it's good to see the commission is updating their telehealth regulations, but we're going to give you a little bit more of a deep dive here to understand what actually is being changed. So ever since the beginning of the medical marijuana program in 2013, there's been a requirement that a new patient entering the program would have to see their cannabis clinician in person for their first visit. And that was in place ever since 2013 until 2020. And as we all know, in 2020, the world experienced the coronavirus pandemic. And the commission, as a result, did pass a waiver that allowed for new patients to be certified by a doctor virtually using telehealth. And that waiver has been in place for over 4 years now. And so in December of 2023, when the commission most recently renewed this waiver, they had indicated that they were open to implementing this in their next regulatory session, so that way they wouldn't have to keep extending waivers for telehealth. So they had waived the section of regulation that said new patients had to be seen in person. So that allowed patients to be seen virtually. And obviously during the coronavirus pandemic, we were all trying to limit our physical contact with one another. So it's understandable. And like I said, telehealth has become a staple of our healthcare system globally now. And as a result, some of you may have experienced this, but we've noticed it at MPAA that over the past 4 years, now that telehealth has become more of the standard, that the price of certifications has lowered. And so that's a benefit where many cannabis doctors' offices don't have to pay the high overhead of a physical office, and they're able to conduct their visits via telehealth. So we think telehealth is a very important aspect of patient access. And we want more patients to be able to get into the program. It shouldn't be a burden on them to have to go in person. But what's curious about this commission's most recent draft is that they're actually not removing the section of regulation that says that your first visit has to be in person. In fact, they leave that section in there, and they add a new section which talks about making a request for telehealth, which I'll read the language here. It says, in the definition of clinical visit, which is at the beginning of the draft regulations here, it reads, let me just pull this up. I'll get to the part of clinical visit. A clinical visit for an initial certificate of registration shall be performed in person, or upon request of the patient via telehealth visit that includes synchronous face-to-face encounter between the healthcare provider and the patient. So what that means is that if you don't ask for a telehealth visit as a new patient, then you won't be able to get a telehealth visit. It would have to be in person. And that's because it says a clinical visit for an initial certification shall be performed in person. That shall means that it's a requirement. So, as Massachusetts Patient Advocacy Alliance, we're not quite sure why the commission decided to keep the language in there that has been waived for the past 4 years. We've recommended that they simply strike the language that requires that a first-time visit be performed in person. There's a lot of reasons why we are advocating for that language to be removed. Obviously, if it's an initial visit in person, there's a lot of patients who that's going to be an extra burden for them to get out to the doctor's office, and may not even be physically possible for them to do. And we don't want to delay patients getting access to this medicine, access to care. And so telehealth is a really important component of the medical marijuana program and patient care in general. So what was originally proposed here was that it would be upon written request of the patient. And Massachusetts Patient Advocacy Alliance did send comment to the commission saying that a written request was unreasonable, and they adjusted their draft to take out the word written to say that upon request of the patient, a telehealth visit could occur. But there's a lot of questions that get raised here, a lot of unanswered questions. We've heard questions of, does this mean that the patient is requesting that, who are they making the request to? Is it they requesting the commission's permission, or are they requesting the doctor's permission to have a telehealth visit? And so, there are also cannabis doctors who do not have physical offices, and they operate remotely, virtually, completely. So if a patient isn't aware that they can ask for a telehealth visit, does that mean that they have to have an in-person visit, and what happens to doctors that don't have physical offices. You know, obviously, if the patient doesn't understand that this option is there for them, it's going to lead to a lot of confusion and increased complexity for them if they are being told that they have to have an in-person requirement, in-person visit. So, you know, personally, MPA is advocating for the commission to remove the requirement for an initial visit to be held in person. We're not quite sure why, after 4 years of waiving that regulation, we would want to keep that in place. People have become familiar with the medical marijuana program as it has been for the past 4.5 years, and to kind of go back to having that play a stake in patient access is concerning. We don't want patients, especially new patients that are not familiar with our regulations, to be confused about how to get their certification. And some of you may be wondering, does this affect renewals? And the answer is no. Renewals can be held in person or virtually, but the commission isn't putting this very specific language around renewals. It's only around first-time visits. And like I had said, new patients who don't understand the intricacies of these regulations may be confused by this request mechanism. And, you know, how is the commission going to enforce these requests? Are they going to check up on the doctors and audit their requests? And another concern is these doctors sometimes don't get back to patients on the same day, or you know, patients are leaving a voicemail. And so we don't want to see patients being delayed in getting their certification because of this request component. So we're suggesting that the commission simply remove that requirement for an initial certificate to be held in person, because the definition of clinical visit already says clinical visit means an in-person or telehealth visit. So it's very clear whether it's for of an initial certification or a renewal, that a clinical visit is able to be conducted both in person and via telehealth. And from what I understand, the commission really just wants to give the patients the power to make the choice. And so I understand that, but this certain language also requires that if you are going to have a telehealth visit, that it is a face-to-face video encounter. And that is also something that concerns us, because certain patients that are elderly, which is a large population of cannabis patients, may not have smartphones or video technology to have this virtual visit. And telehealth does extend beyond virtual. The commission's, I mean, sorry, the telehealth does extend beyond video visits. It does also mean telephonic visits. And so we're also wanting the commission to understand that telehealth is more broad than just video visits. And we don't want to see a situation where doctors are not able to practice their craft and practice medicine by removing some of these tools like telephonic access, because some patients aren't going to be able to have this certain type of telehealth visit. So we don't want to tie the physicians or a certified nurse practitioner's hands behind their backs. You know, we don't want to be restrictive. I feel like we want to normalize cannabis medicine here in Massachusetts. So I think if we standardize our practices with telehealth similar to how it is done in the normal healthcare system, then we're not treating patients differently. And patients do feel marginalized, and that medical cannabis is treated differently than other medicines. So, you know, in the spirit of normalizing cannabis medicine, we're advocating for the commission to really adopt a telehealth model that gives patients the power to choose, but doesn't, really what I'm saying is the regulations need to be readable and understandable. And the current draft here just has lots of unanswered questions about how the patient is making this request. And also, if the patient can simply just make the request, imagine everybody makes a request and they all have virtual visits. So I'm not quite understanding why we have to have this new idea of a request when the program has been running fine this whole time, and we've been essentially waiving the in-person requirement for telehealth. So that's the major component in this regulatory adjustment. And, you know, this mainly affects new patients, but for those of you who have used telehealth in order to access the medical marijuana program, just think to yourself, if you didn't have the ability to have telehealth, that would you have been able to get access to the medical marijuana program as easily as you did? And so we want telehealth to be incorporated into the regulations, and we're glad the commission is putting this into their regulations finally, instead of continuing to reissue waivers. But we need them to recognize what telehealth truly is, and not just limit patients to a video visit for their first time. And it's not the norm for patients to have a telephonic visit, but it's something that, like I said, we shouldn't be making our regulations so restrictive that doctors don't have the full ability to use telehealth in the manner that they do in the traditional healthcare world. So, the commission has made restrictions in regulations that they want to roll back. And I don't want to see patients be in a position where these new rules are burdening them, putting an extra step in front of them getting their certification, and something that they commission in the future may have to roll back because it was too restrictive. So I would encourage all of you to take some time to think about this aspect that I've gone over. And next, I'm going to take some time to talk about the certified nurse practitioners, but I will also take some time to talk about the process by you can come to the public comment sessions or send in comment to the commission, and that will happen sometime during the late summer, fall period. So I did discuss telehealth, and next we're going to move on to the next major component here, which is certified nurse practitioners. So this is a positive update. In the history of the medical marijuana program, there's always been physicians and certified nurse practitioners and physician assistants. And in the regulations, these nurse practitioners have had to be under the authority of a physician. And in actuality, in reality, some certified nurse practitioners have independent prescribing authority. So they actually can operate and prescribe without being underneath a prescribing physician. And so the commission is updating their regulations to give nurse practitioners with independent prescribing authority the ability to certify medical marijuana patients without a supervising physician. And this is consistent with the regulations of the Board of Registration in Medicine. In nursing, Board of Registration in Nursing. So this kind of aligns the commission's regulations with what is allowed in the nursing field. And if there are nurses who are able to independently prescribe, we believe that they should also be able to independently prescribe medical cannabis and certify patients, and that this is a good update because now more certified nurse practitioners could potentially get into the medical marijuana portal and certify patients. So more providers obviously is a good thing for patients to have choice between different providers, and depending on where they're located, can help serve certain areas of Massachusetts. So there's not much that I have in terms of discussion on this, but I just wanted to bring this all to your attention that the commission is looking to make it a more streamlined process for these certified nurse practitioners and kind of remove the restriction that they be supervised by an overseeing physician. So this is a good thing for patients because that way more certified nurse practitioners can certify patients, and there'll be more providers out there for patients to choose from. So, and I think the commission went ahead and did this because it was consistent with making this update about telehealth. So while the commission was making adjustments there, they decided that the certified nurse practitioner update, it was a perfect time for that. So we couldn't agree more. We're very happy to see that. And those are the major two updates that are happening to the medical marijuana program. And I may be, saying what you're thinking, which is that that's it. It seems like a kind of small list of things that really there are other patient issues that could have been addressed. And, the commission has said that they're looking to do another regulatory adjustment this year. By the end of the year, potentially have another draft ready. And so that is an opportunity for all of us to kind of get our ideas together and see if the commission's not doing this adjustment right now in their regulations, what can we advocate for in this next regulatory adjustment? So I see a number of you have joined, and I just want to say hi. Thank you for joining. We were talking about the draft regulations that the Cannabis Control Commission recently voted on in July, and the fact that in the coming weeks, there'll be an opportunity for us all to send in comments on these regulations and make our voices heard and influence the final outcome of these regulations. So I would encourage you all to stay tuned. The commission will be releasing these details, and so will MPAA. We'll make sure to keep you on top of this. And if any of you have any ideas about some of those next steps of the medical program, we want to hear them. Please send some ideas in the chat. And if you have any questions, I'll go ahead and answer those too. But I'm also going to bring up some of these subjects that we think that patients have brought to us that they want to see. And besides telehealth and nurse practitioners, the last issue that is coming up in this next regulatory adjustment is micro businesses. It's an adult use cannabis license, and they're a small business. And so the commission is looking at ways to kind of allow them to get to grow. And so one of the ideas was to allow them to buy product directly from medical dispensaries. And in some discussions with patients and also with the commission, I think there's just some general confusion about where this came from or what the purpose was behind it. A micro business is an adult use license type, and for them to be buying products from medical dispensaries, it's just a question of, there are very few micro businesses and very few medical marijuana standalone operators. So most medical marijuana dispensaries are co-located, and they have a patient supply protection that they have to abide by. So we wanted to make everybody aware of the fact that micro businesses under this draft regulation may be able to buy product directly from medical marijuana dispensaries in order to process that marijuana into manufactured goods like edibles or concentrates. We've been pushing to try to get micro businesses and other adult use license types the ability to be medical, but this draft regulation doesn't go that far. It simply allows the micro business to buy supply from medical dispensaries. So some patients have raised concerns about the way that would drain potentially patient supply, and so that's one concern that we're aware of and we're looking at. And we obviously understand the commission is looking to adjust micro business regulations to let them grow, but we're also hearing about business closures in the state as well as medical dispensaries. And we're really getting concerned that after hearing a few medical dispensaries have closed in recent months about the future of the cannabis industry. And so we want to protect patient access and medical marijuana. So that's something we're keeping our eye on, because we obviously have to make sure that medical cannabis is available for patients and that, we don't run into any supply issues. So we're trying to expand the ability for more businesses to be medical, but for the time being, we have to protect what we have. And patients obviously are looking for access in different areas of the state. So we're trying to expand that access and work with the commission to do that. So those are more of the three areas that I think touched patient access. And more, going forward, I want to discuss the how you can impact these regulations by speaking out, because we are going to be speaking out about these regulations. The commission is going to be having a public comment session, and we are asking you to keep yourself, informed, stay on top of this, and please come out to these hearings or send comment to the commission if you're wanting to protect access to things like telehealth, or have the commission pass these regulations to have more certified nurse practitioners and other clinicians as part of the program. I also want to take a moment also to answer any questions or read any comments that are here. And for now, I see a lot of waves on Instagram. So waving back to everybody on Instagram. And on YouTube, I'm hearing that we have support for state-to-state reciprocity. That is something that I'm hearing more and more of every day, that patients from other states should be able to use their medical card here in Massachusetts, and vice versa. We should be able to use our medical card in other states. For example, we can use our medical card from Massachusetts in Maine, and a new state that also allows for reciprocity is New Hampshire. So we want to see more states allow for reciprocity. Massachusetts does not allow for reciprocity with other states. And we believe that those patients in other states, when they're visiting Massachusetts, should be able to take advantage of our medical program, because in some instances, our medical program is superior to some of the medical programs of our neighboring states. So we want to be able to take care of our patients, the people who are here in Massachusetts when they're here, and definitely very supportive of reciprocity. That is something we're going to have to attack, though, in the legislature. And I will get into a little update about our legislative process at some point here. And I also have a comment about allowing micro businesses to service medical, since they opened the door. So definitely we want to see micro businesses be able to serve medical, and more businesses be able to do that. Medical did come first. And so that was one of the comments we've heard from some patients, is we got to make sure that that our supply is protected and that our needs are also not overlooked, because this micro business is an adult use license at the time being. And so there's no real way for them to make medical products and kind of distribute that or kind of bring it back into the medical supply chain. So, we do support the commission has made several adjustments to the micro business regulations, but we're taking a deep look at that. And if you are concerned or have any thoughts about micro businesses buying medical marijuana supply, feel free to let us know how you feel about it, and just know we're taking a look at that. And that kind of ties into the public comment aspect of this, which is important for people to understand how the process works. So the commission puts out a draft of their regulations with updates, so that way people can understand what updates are happening, and those changes are highlighted in red so you can see what is being changed. And there's a timeline where the draft changes are sent to the Secretary of State. They publish them in a register, and once they're published, there's a timeline for the commission to publish a public hearing. So individuals can send in comment virtually via email, or attend this public hearing in person or virtually to share their comments. And so normally at one of these hearings, you will be limited to 3 minutes in a speech. So you have more time to write in written comment. And obviously with no limit on written comment, you obviously want to also keep it kind of concise and readable. If you go on too long, the commissioners may not get the message that you're trying to say if it's kind of over such a long message. So try to keep your points concise and understandable and readable, and keep an eye out for these public hearing dates. Sometimes we have multiple hearings, but in most cases, it'll just be one hearing in public and the opportunity to send in comment for several weeks. So the commission did approve these draft regulations on July 19th, but we have not seen any publication of this scheduled hearing. And we haven't seen that it's been published by the Secretary of State quite yet. So there will be some time. So, I would anticipate maybe sometime in September or October. So just as a rough estimate for these public hearings. So you can send in comment via email. You could send in a letter via the old snail mail, or you can go in person and make your comment. So definitely consider that, because the commission has said multiple times that they want to hear from different people. Obviously, they hear from me because I'm speaking on behalf of a lot of patients, but they do want to hear from individuals to kind of back up some of these points. So whether it's in the adult use or medical space, when public comment comes out, they want a lot of people to come out and share their thoughts. So it's important that they hear from new folks, and everybody's perspective is kind of incorporated into this draft, because after the public comment period, the commission will take some time to incorporate every piece of feedback they received and incorporate and make adjustments to their final regulations. So that's why I think it's important that we're talking about telehealth, because we're not quite sure what the ultimate change will look like. And since they're already adjusting it, we don't want to see them they're already kind of heading in a direction where it's getting more complicated, I think, than it has to be. So, we're kind of there to help put the guardrails on and say, this is where we think the regulations should be with telehealth. And I get concerned about, we've had 4 years where there's no telehealth. I'm sorry, there's no need to have in-person visit. And then all of a sudden we're going to keep that part of the regulation in that says you shall have a visit in person unless you request a telehealth visit. So that's the major aspect that we're looking at. And when the commission comes out with their final draft, they will meet and they'll go through all the sections that are being adjusted and discuss whether or not they want to make adjustments, and then finally vote on that final draft of the regulations. Once that final draft's put together, they'll send it to the Secretary of State again. And at that point, it's pretty much solid and not able to be changed. And that's once it takes effect in the register by the Secretary of State, you've now got a new set of regulations. So there is a process. And like I said earlier, the commission is looking at potentially doing a second regulatory adjustment this year and having another draft published at the end of the year. So it's important that if you feel like this telehealth adjustment and this certified nurse practitioner adjustment isn't enough, that we really put our heads together and understand, what do we want to see? What would make our medical marijuana program the best it could be? Because if the commission is looking to make some of these adjustments and remove some of these foundational barriers and restrictions of our program, then we should really work to give them those suggestions and make sure that they are aware of what we feel are the patient policy priorities. So, telehealth is and certified nurse practitioners is a great start, but I could probably list about 10 topics that patients have brought to my attention over the many years that I've been advocating that need to be incorporated. So I hope to work with all of you to get some of these incorporated into the regulations if there is another regulatory adjustment at the end of the year. So one more comment I have here coming from YouTube. We've got medical and recreational employment requirements should be the same. That's another legislative requirement, but that's something we also are looking at, as well as housing protections. So, we want patients to really be in a position where their cannabis use is normalized and respected as medicine. And we do have that currently to a degree that, we've seen court judges respect medical cannabis, for people who are on probation. We've seen state agencies like the Department of Children and Families respect medical cards in situations where they step in. But what we do need is explicit protections for medical patients for their employment. And so that's one thing that there actually has been court cases on, and I've actually heard from patients where they've tested positive, maybe in a P test for their new job, and the employer said, "Well, do you have a medical card?" And they said yes, and they exempted the positive test for cannabis and let the person get their job. So we want to strengthen that protection and also do the same thing with uh, with housing protections, because we don't want you to be fired because you're a medical cannabis patient, but you also shouldn't be able to be evicted because you're a cannabis patient. And we've heard lots of situations where patients have had run-ins with their landlords and their neighbors, and so a lot of the times, patient ends up on the short end of the stick there, and they they need extra protection. So that's something we're definitely working on having in this next legislative session. So I think that brings me to talking about the legislative session, which is a small update here from Beacon Hill. It's a 2-year legislative session. We're right about at the middle point, a year and a half in, 6 months or so, till December, when the end of the legislative session is. So the real update is that most cannabis bills have stalled in committee. The end of the formal legislative session was July 31st. Now we're what's called informal session, and that is a time that has different rules for legislators. Really, the major rule is that one lawmaker can kind of object to a bill and kind of derail it from moving forward. So while bills still do move forward in an informal session, it's a little bit different of a process. So it's a little tricky, but it doesn't mean that it's over quite yet. And so if there is cannabis legislation that you are supportive of, that we talked about in our last webinar, if you want to take a look at that and follow up on it, it doesn't hurt to reach out to the committees to let them know that this is something you support, even during the informal session. Carrying that momentum is important. So right now, it is the informal session, and at the end of December, the legislative session will end, and in January 2025, a new legislative session will begin. And in January, that is the time when new bills are filed. So that's going to be our opportunity to work with lawmakers to get these ideas like housing protections, reciprocity, workplace protections filed in a legislation, and then have these hearings where we invite all of you to come speak and tell the lawmakers why this needs to make it through the legislature. So it is really important that the legislature that we are aware of this avenue, that there is the legislature and then there is the commission's regulatory process, and they are different. And so sometimes things that can't be done by the commission, we have to go to the legislature for. So we do want to see the legislature update certain aspects of the law. Some things the commission can do, some things only the legislature can do. And there has been a lot of, how should I put this? A lot of interest to adjust medical, but to get everybody on the same page on Beacon Hill is difficult. And this year we've done a lot of advocacy, and I want to thank all of you who have written postcards and sent emails. I feel like our momentum this year was larger than it has been before. And that's what's necessary. If we're going to change cannabis reform, it really is incumbent upon all of us to pick up the torch and advocate. It might be a little bit intimidating for some patients, but like I said, they really do want to hear from constituents that are cannabis people. The legislature doesn't often hear from cannabis people, and so when you do go in to speak to them, they do want to hear your feedback. So please consider that avenue of the legislature, make connections with your lawmakers, and continue to work with MPAA, which we're happy to push some of these issues forward. And we really do want to see our laws get updated as time goes on, because cannabis is such a new topic that we can't have a stagnant or static program. We need to update the laws as time goes by to meet the needs of patients. So it's important that we all understand we only are here today because of some really dedicated folks who spent years of their life advocating to decriminalize cannabis and to get it recognized and eliminate this stigma. And we now have to thank them for all that hard work, but also recognize now that we have our voice, and that if we all speak out, there's 90,000 medical marijuana patients in the state. and plenty more who could be in the program if we made it more accessible, if we all kind of raise some awareness about medical cannabis. So I think it's important for us to break that stigma down by speaking out to the commission and sharing our experiences as patients, because I've heard a lot of stories and a lot of experiences that could, that we could adjust the regulations to meet the needs of patients better. So happy to work with you all on that. And one comment I have here is to remove the regulation restricting sharing of cannabis and also speaking at dispensaries with each other. Yes, I'll take the second part first, which is I've heard about that aspect with several patients and even experienced it myself helping people out, that agents at the dispensary will essentially only want one person at the register at a time, and kind of say, well, unless you're a caregiver for the patient, you can't be here at the register with them. And obviously the medical dispensary is very limited who can get in there, only patients and caregivers. And so, I think it would be smart to kind of make it clear that that it's not anything to be worried about, that patients are together in the dispensary. So I think that's definitely something that I've heard from other patients and is on our list of things that we want to bring to the commission's attention. And also the restriction of sharing cannabis is a big topic. And we are working on how to fit this into the regulations in terms of the language of it. But it's fair to say that medical cannabis itself is something that people share with each other. And a lot of the times, the way I think about it, it's less about the product; it's more about the person who's using it. It's my photo on the medical card. I'm the patient, and so the cannabis that I use is my medicine. So gifting is something that was incorporated into the adult use law, but I think it's also important that patients aren't unfairly penalized or have the same kind of ability to, share their medicine with each other. And what I'm saying is more or less that similar to how cannabis is socially shared, that, some patients are very kind and will give cannabis to a friend in need who may not be able to afford it or has run out. So that's the kind of situation that I'm talking about is, patients want to help other patients. And so, cannabis is expensive. And so, we don't want to be in a situation where somebody isn't able to get their medicine or they're afraid to share. So our laws do allow for sharing. So, we do have to update the medical rules to make sure that a patient in that situation, that's helping others, isn't unfairly punished, because if you're living in the same household or something like that, it makes a lot of sense that even if you're growing, that you could be gifting to others. So one of the other aspects here, yeah, exactly. If just sharing a joint is wrong, then that's, we're not doing it right, essentially. So, for some people, one hit can really get them from, a place where they're really debilitated to a baseline. So, that's something people don't often understand, that they think everybody's just getting high, but a lot of patients use cannabis just to get well. So it's not that, it's not like recreational. And it's something that we have to respect patients and make sure that they have what they need. So I do want to also take some time to answer any questions. Took some time, set aside some time for questions. If anybody is wondering about these regulations, how they might reach out, what the timeline is, or if there's something that is happening in your experience as a patient or a caregiver that we can improve. I did want to kind of go over some of the ones that we've thought of at MPA or had patients bring to our attention, including, a lot of the times the certification date and the registration date on your card are different, and patients will show up to the dispensary and be told that their card is not active and they can't come in. And that happens more times than you can believe. And, patients shouldn't really be in that situation where they're not aware that their certification is lapsed, or that the date that's printed on their card makes them believe that their card is still active. So we want to work with the commission on a way to make the dates equal. So that way patients don't have this confusion, because I feel that many patients don't understand how these dates got so far apart and what they mean. And if we could just line them up, it would really simplify the process. So that's one thing that patients have brought to our attention. I also think that many of you have brought to my attention the signing of documents at intake at medical dispensaries takes up a lot of time, and patients are supposed to be prioritized at dispensaries, but having to fill out all that unnecessary information at intake while recreational customers are kind of being ushered through, at this point, it's not necessary for these medical dispensaries to be making you initial all these attestations, and it's something that we're looking to bring to the commission's attention in terms of it's being a burden on patients and unnecessary, especially because it's not required at recreational stores. Recreational companies are actually not allowed to collect more customer information than what is necessary to conduct a transaction, and so I think the same should be in place for patients. They should really only have the information that's necessary to conduct your transaction. So another on the same line as that is your card. If you say you lose your license, your card, would you be able to show a photo of it to the agent? Because your P number is on there. They can look it up in the system and see whether or not you're active without your actual physical card being there. And so we're going to bring this to the commission's attention in terms of a digital card, or patients being able to be looked up by their P number, but maybe not having to have their physical card on them, because patients will potentially lose their card, and the commission has the online portal, but it's something that's difficult for a lot of patients to navigate. And so if they had a photo of their patient ID on their phone, would the commission essentially allow that to be their proof of identification for their medical card? And if you can put in that patient identification number and see that the patient's active or not, then I think that this is something that could work and could kind of clear up a lot of headaches for patients that maybe lose their card, and it's been a rough day and they just want to make sure they can get their medicine. So we're thinking about the patients that lose their card, and including those who lapse. And in terms of lapsing, another issue is the length of a certification. And why shouldn't a doctor be able to write multi-year certifications to patients? This annual registration with the medical marijuana program really does create a lot of headaches for patients, and a lot of patients have chronic conditions that aren't going anywhere. So, and the other aspect to this is we really shouldn't be writing our regulations nowadays in a way that's so strict that it limits a doctor from giving a multi-year certification. Sure, most doctors may continue to still write a 1-year certification if they want to, but why not give them the ability to do it if one doctor wants to write a 3-year certification to a patient whose condition is debilitating, chronic, and not changing? So, thinking about the future of our regulations instead of how we've done it in the past, we really should be trying to graduate and evolve. And so I think that's a perfect example of how to do it. So, patients want updates to their program. And so, there hasn't been a lot of change over the past 4 years, and we really want to see more done besides the telehealth and the certified nurse practitioner aspect, because as I mentioned earlier, we are seeing some dispensaries close. The market is in a different place than it was 4 years ago, 5 years ago, 10 years ago. So in order to protect the medical marijuana program, we have to be on top of this and advocate for the commission and the legislature to change these laws and regulations. So another comment I've got here is lab results should be posted online by the state. So that's not a bad idea, because the commission does require every batch to be tested, and so those reports do exist. The regulations do allow for individuals to ask for the certificate of analysis, but if that information was available to people in a lot more, uh, you know, accessible of a place, then I think patients, especially, could feel better that it's a tested product that passed the guidelines. And there's also a lot of questions about lab testing that the commission has gone through this year and kind of adjusted things. So, there used to be a lot of 40% THC cannabis out there and not so much anymore after that adjustment. So, in terms of patient care and being able to get the dose that you're looking for, it's important that the test on the product is correct, valid. And if you really do want to get down into who tested it and the minor cannabinoids and all that sort of stuff, then definitely the lab results would be a great way to get that information. So that's something that could be very helpful for patients and caregivers, and quite possibly the clinicians as well, who are advising patients on the products or the mechanisms, the modalities to use cannabis. So, that's a great point. There really are a lot of aspects that we could improve, and that's kind of what I'm asking all of you to do, is think about some of these changes that we could bring to our medical marijuana program that could make it the best that it could be. And we can put them into legislative versus regulatory buckets, but we're going to go forward and push for all of these, whether it's regulatory or legislative. So what can we do to make our medical program the best it can be and get more patients into the program, normalize cannabis as a medicine, and eliminate stigma? So please send your suggestions, and know when public comment comes, the commission does want to hear these comments. So please send them to the commission and stay in tune with what MPA is doing, because we'll let you know when these hearings are, and we'll keep you updated in terms of how we're going to advocate for the things like telehealth and certified nurse practitioners. So we're coming up on the end of the hour here, and I want to thank everybody for attending tonight. If there's any additional thoughts or questions, please feel free to send them in the chat. And I just want to send another wave to everybody on Instagram. We had quite a few people check in, and we're glad to speak to all of you. And we've been posting a lot more to try to get more engaged with our audience and let patients know about what's going on. So please stay tuned to more of what MPA is doing, and just know that your voice and your experience really does make a difference. I've been doing this for 10 years now, advocating for cannabis policy. And while the initial thought of advocacy or lobbying is, what is my one voice going to do? How much of an impact can I make? If all of us thought that, then we'd never get anywhere. And we see rallies and groups of people who get together and make their voice heard, and the impact that they have. And so we each all have a lot of power behind us. And the commission isn't looking for you to have a perfect college degree speech that is like a movie speech. No, you don't have to be like that. You can just give them suggestions on their policy from a patient perspective. And that's what we do. We look at everything from the patient perspective. And that's why we're going to be fighting to make sure that the telehealth regulations are not too restrictive, because we don't want the request element to leave patients asking a lot of questions about how to get into the program. If patients for the past 4 years have been able to get certified in person or via telehealth, then it's not really necessary for us to have this language that says that you have to have your first visit in person, or you can request it via telehealth. It just seems like the commission kind of doesn't see that medical patients really come from all different walks of life, and their debilitating conditions really do range. So, especially if we're talking about some older folks that don't have access to some of this technology, adding this request element to it, and also making patients have to, saying that you have to be in person if you don't make the request. It's something that we just don't want to see patients have another barrier put in front of them and the doctor's visit. So we're trying to make the process simpler, easier, and something that is in line with what we've seen over the past 4 years. So it's yes, and thank you for that comment. Regular telehealth can be audio only versus Massachusetts law. I actually meant to read the definition of telehealth, which is the use of synchronous or asynchronous audio, video, electronic media, or other telecommunications technology, including but not limited to interactive audio, video technology, remote patient monitoring services, audio only telephone, uh, and online adaptive interviews for the purpose of evaluating, diagnosing, consulting, prescribing, or treating or monitoring the patient's physical health, oral health, mental health, or substance use disorder condition. So when we say we want to give patients the choice between in-person or telehealth, it has to really be telehealth for that to be true, that you want to give patients the choice to have telehealth. And otherwise, you're really taking the power away from them to have true telehealth, and you're trying to redefine what telehealth is to only video visits. And so, telehealth is what it is. And for the past 4 years, this hasn't been an issue. So, I'm not quite sure why the commission had to write it this certain way. We are happy to see that they took the section out that said written request, but still, that doesn't go far enough to improving this section. So, I would call on everybody to take a look at that section of the draft regulations when public comment comes out, and join us in telling the commission to really put something together that's straightforward, that's clear, that's consistent, and is applied equally to first-time visits and renewals, because patients have the power to choose for the in-person or telehealth visit already. So this extra language doesn't give them extra power to choose telehealth. It's not like in-person or telehealth is being forced upon them by the doctor. In fact, it's the regulations that are forcing certain types of visits on patients. So we definitely want to be in a place where, if it's allowed for regular medicine, that audio visits are possible. We don't want it to be excluded from medical cannabis for first-time visits. And like I said, is it the norm that a first-time visit is via telephone? No, but it is part of telehealth. And if we're going to say that patients can have access to telehealth, it has to be access to telehealth. Otherwise, you're taking the part of the toolbox away from the clinician. And, there really are situations where it may be warranted for a clinician to have a telephonic visit with a patient. So that's where we're coming from. And we're looking out for those patients who don't have access to the face-to-face video consults and have chronic conditions that aren't changing, and the physician can review their condition through the paperwork and in consultation with the patient. So that's the major update. And so I appreciate that comment, and I appreciate all of you who have come today to hear from MPAA. We are Massachusetts Patient Advocacy Alliance. We are fighting for medical marijuana patients. We're there every step of the way, fighting for you. And so please fight with us. Come join our advocacy, and we will be advocating at these public hearings. And so please visit our website to sign up for our email newsletter if you're not already. Follow us on social media, and we appreciate your support. Medical marijuana did come first, and so we're just here to protect the patient and make sure that medical marijuana continues for decades to come, that those of us who are relying on it can continue to age in place and rely on medical cannabis, into our adulthood and into our elderly years. So medical cannabis really is a miracle. And so glad to be here in Massachusetts, where, really a lot of our freedom as a country started. So it's important that we have one of the best medical programs in the state. So please reach out, share your ideas with us, and we will continue to fight on behalf of patients and medical cannabis. So I hope everybody has a good night. And this concludes our webinar. And we hope that everybody has a good night and enjoys their evening. And we hope to work with you soon on medical cannabis policy. So have a good night, everybody. Thank you.